perimenopause. Let's start with the basics. Menopause is officially when you've had 1 year without periods or 12 consecutive months without periods. And perimenopause is the 10 years leading up to menopause. So you could be in your late 30s, you could be in your 40s, honestly, because the average age of menopause is 51. So basically, perimenopause is that stage, or actually there are several stages in perimenopause. So check out my one video that I did specifically about stages of perimenopause. And so that 10 years leading up to it, you could be in perimenopause. So what are the signs of perimenopause? So they're actually the same as menopause. There's actually 60 reported in the literature. So hot flashes, night sweats, vaginal dryness, difficulty sleeping, unusual symptoms like ringing in the ears, itching. But for perimenopause specifically, to diagnose it, it's made by a clinical diagnosis, meaning that you had changes in your cycle. Either they're getting shorter or longer, you're over the age of 45, and you're experiencing these perimenopause symptoms. If you're not sure if these symptoms match what you're experiencing, check out my video that is specifically saying the unusual symptoms of perimenopause. So back to labs. Do you need labs? So the North American Menopause Society, which is a pretty big organization, says labs are not necessary to diagnose perimenopause, but could be helpful. And in the cases where it could be helpful would be if you're, say, under the age of 40 or 35, and you feel like you might be in menopause, getting an FSH level and an estradiol level can help you make the diagnosis. If you don't have periods, maybe you had a hysterectomy or an ablation, you really don't even know if you have any period changes and are not sure if you are actually experiencing perimenopause, or labs can be very helpful to rule out other hormonal conditions like a thyroid problem or severe vitamin D deficiency or something that mimics very similar symptoms to perimenopause. So while they're not necessary, they can be very useful, especially if you're diagnosing something like premature ovarian failure, which is when you have menopause before the age of 40, or early menopause before the age of 45. Those particular categories are unique in that those women have higher risk of long-term heart disease and other comorbidities. So it's important that we know if they're in menopause and get started on hormone replacement therapy early. The earlier, the better. So what labs would you draw in those scenarios? So the standard Western medicine labs are FSH, follicle stimulating hormone, and estradiol. And remember, there are 3 estrogens, but estradiol is the predominant one. And FSH and estradiol are done at least a month apart, and then you can diagnose someone as being early menopause or premature ovarian failure because their FSH level will rise and their estradiol level will go down. Sometimes people talk about AMH level. I don't particularly use AMH unless I'm referring to fertility specifically. So AMH is not part of the criteria to diagnose premature ovarian failure. So if we're going back to sort of North American Menopause Society guidelines, it says it's not necessary but could be useful in those situations that I told you about. But I personally think all menopause women and perimenopause women should get lab work. Why? Why do I do things differently? Because in my mind, I want to know a baseline. I want to understand what is someone's hormone levels before I start hormone replacement therapy, and what have I done to optimize them, especially if I'm aiming for, say, an estradiol level between 50 and 100 to optimize for brain and bone and muscle. I want to make sure I know what their baseline is. So why am I doing things differently than Western medicine? Because the guidelines say don't test perimenopause, because when you look at the hormone graph, and here's the graph, you can see that the levels of hormones actually kind of fluctuate like a roller coaster, but ultimately going down with age. So when you look at someone's age, when they hit 35, 40, you can see their overall the estradiol level is going down, but it's in a roller coaster fashion. So you could test someone, for example, and then 3 weeks later test their hormones again, and 3 weeks later test their hormones again, and it could be wildly different. It could be one time being 20, one time being an estradiol level of 250, and another time being completely normal at 100. So the recommendation says don't test because it's so difficult to understand. First of all, if you test hormones, you need to know what day of the cycle it is because that matters. And you also want to understand this fluctuation. So a lot of times women are told your labs are completely normal, but they don't feel normal. And that's because of this roller coaster of hormones as they decline. Because you can imagine a perimenopausal woman could feel difficulty sleeping, low libido, having energy issues, and then their estradiol level comes back completely normal. Because in medicine, we have these lab values that say postmenopausal and premenopausal. So this is why a lot of women are not being tested to diagnose. And I agree with that. You don't have to test someone to diagnose, but I disagree with it. We don't need lab work. And here's the labs that I typically typically order. So I break down the labs into categories because in my practice, I focus on prevention. I want to make sure someone is healthy now and in 5 years and in 10 years. So we have to look at what are the things that women are at risk for: heart disease, cholesterol issues, bone loss, muscle loss, metabolic inflexibility where they gain weight. So I want to make sure I check those labs so that I can help someone optimize their health. So what are the labs that I specifically recommend and test in my patients? I have these kind of core labs and I break them down into those categories. So metabolic and inflammatory markers. I always test fasting insulin and a hemoglobin A1C because it tells me if someone has insulin resistance as maybe a cause of their weight gain or causing inflammation. And I want to know hemoglobin A1C if I'm concerned about diabetes or any blood glucose issues. I sometimes check HOMA-HR, which is more specific marker for insulin resistance. I check HSCRP, which is an inflammatory marker. Not only is it important for inflammaging, but it's also important for heart disease risk. It tells you who is the person that really needs to be on statins when you combine it with a cardio IQ to understand overall heart health. And then a basic blood count. And that's part of typically standard medicine as well as CBC. I do like homocysteine levels too because I want to know someone's folate and B12 levels in the way that I want to know their cardiovascular risk. So now to cardiovascular health. So I don't just check a lipid panel, I check a cardio IQ from Quest or an NMR, which includes an ApoB, LPA. Those are genetic risk factors and tell you what is really your risk for cardiovascular disease. In combination, I sometimes will check an omega-3 index if I'm concerned that someone is trying to get omegas in their diet, but is maybe not hitting the mark. And that gives me really a better assessment of someone's cardiovascular health and understanding whether or not they're at risk for heart disease. Do I put them on a statin? Do I not put them on a statin? And then finally, hormones, right? Hormone fluctuations. So I check fractionated estrogens because I want to know estradiol, estrone, estriol. I check total and free testosterone. I check DHEA, which is the adrenal combination for testosterone, DHEAS, and DHT if I'm concerned about hair loss, and obviously progesterone. I will also sometimes check SHBG if I want to know if I can affect their testosterone levels and essentially get more free testosterone. And it helps me, especially with men, I think it's important to check an SHBG. And then the other hormones, right? I always check thyroid, a full thyroid panel, TSH, free T4, free T3, because I want to understand, do they have hypothyroidism? Very common to develop a thyroid problem in midlife. And really the symptoms are very similar. Brain fog, fatigue, bone pain, constipation, weight gain. So you really want to make sure you don't have a thyroid problem. And lastly, the other hormone that we call a vitamin, but it's actually a sex hormone, which is vitamin D. A lot of women are vitamin D deficiency in menopause, and we have lots of good data now looking at reduction of breast and colon cancer with vitamin D levels that are adequate. So I always check vitamin D. And I want it optimal between 60 and 80, not 40. Quest says 18, which I think is crazy low. And then lastly, I check electrolyte panels. So you want to make sure someone's kidney and liver function is normal, their calcium is normal. So that's sort of part of the routine Western medicine labs as well. I sometimes will dive into nutrient labs and test someone's folate, but it's kind of more of a personalized approach, or even do functional medicine testing like GI testing. But it really depends on what are the symptoms a patient is having and what are the goals we're trying to reach. So are we looking for sort of more longevity type goals? So those are kind of the basic labs that I test. I know it sounds like a lot, but honestly, I want to approach it from several different angles. I want to look at heart health, bone health, and sometimes I will actually order bone turnover markers. I want to make sure that someone has seen the whole picture of their menopause care. So lab work to me, I think, is fundamental. Lab work is necessary. Again, not to diagnose perimenopause specifically, but to understand what is the health of a perimenopausal woman. And it can be very helpful for setting out your menopause plan long term. So if you like this video, please like and subscribe. Please share it with your friends. Let me know if you have questions, and I would love to make videos specifically that you are looking for that information. I enjoy bringing this content to you, and I love feedback. So let me know.